Senate Democrats are holding out for Congress to extend health care subsidies, which expire at the end of the year. That could result in higher out-of-pocket costs for millions of Americans. Madison Elliott is getting the facts on what it means for your family. Madison?
We're less than a week away from open enrollment beginning, and according to Governor Beshear's office, people in Kentucky will see a big increase in their health care costs. Governor Andy Beshear and Congressman Morgan McGarvey sounded the alarm Tuesday during a virtual press conference, saying without ACA tax credits, Kentuckians will pay thousands more in annual premiums.
American families should never have to choose between affording groceries, paying the rent, and being able to afford health care coverage.
So what's the actual impact? We got the facts. Open enrollment begins on Saturday, November 1st. At that time, nearly 100,000 people in the state with insurance plans through Kentucky's Marketplace will see up to 37% higher premium costs for 2026 coverage. This is a 10 times bigger premium increase than in recent years. Louisville resident Ann Pipes, who is a self-employed real estate appraiser, joined the governor on Tuesday, saying she'll see her premium increase by $900 a month, something she won't be able to afford.
It's hard. It's going to be the first time in my adult life, if this does not get solved, that I'll be without insurance.
According to the Hearst data team, Marketplace enrollment under the Affordable Care Act increased in nearly every state over the last 5 years, including here in Kentucky. The Commonwealth has seen a 17% increase from 83,000 people in 2020 to 97,000 in 2025. McGarvey says he's open to working with anyone to open the government back up and keep rates from skyrocketing.
Let's make sure that we are lowering the cost of Americans' health care because it's the right thing to do, and it's going to have an impact on everyone if we don't.
And it's not just in Kentucky. Marketplace enrollment is also up in Indiana. It's increased 155% over the last 5 years, going from 141,000 people in 2020 to 359,000 people in 2025.